losing health coverage, I mean, it's like one of those things you just don't want to think about, right? But it can happen, and it can be stressful.
Oh, yeah. It really can throw you for a loop.
Totally. So today we're going to dive deep into what you can actually do if you lose your health coverage. Like, what are your options?
Yeah, we'll focus on what happens when you lose coverage from a job or even through Medicare Advantage or Part D.
Exactly. And, you might be going through this right now, or maybe you just want to be prepared just in case.
Always good to be prepared.
Oh, absolutely. And here's the thing. There are ways to keep your health coverage going without getting hit with any penalties.
Really?
Yeah. So let's break it all down.
Okay, sounds good.
All right. So first things first. You always hear about this special enrollment period.
Uh-huh.
Can you explain what that is like in plain English? What is it?
Sure. So the Special Enrollment Period, or TESEP, it basically lets you enroll in Medicare without those late penalties.
Okay, so like those extra charges you have to pay?
Yeah. Right. The ones that can stick with you for the rest of your life, basically, if you miss your initial enrollment.
Gotcha.
It's like a safety net. But the crazy thing is, a lot of people don't even realize it's there.
See, that's what I mean. It's one of those things you just don't think about
Right.
until it happens.
Right.
So what happens if someone like completely misses that SEP window? Are they just out of luck?
Well, pretty much. I mean, you could end up paying way more for Medicare.
Like for how long?
I mean, forever. Like for the rest of your life.
Oh, wow. Okay, so this 8-month window after losing your job-based coverage or like you said, even certain Medicare plans, that's really important.
Super important.
8 months, though, it feels like a long time, but I feel like when you're dealing with everything else that comes with losing a job,
Oh, yeah, it can fly by
it would just, whoosh, be gone.
in a second.
So, okay, let's say our listeners in this situation, right? They need to figure out Medicare, but what about the cost? Isn't healthcare, like, notoriously expensive?
It can be, yeah. But there are programs that can help with that, make it more affordable, like Medicaid, for example.
Okay.
Let's say you have a single parent working part-time. They suddenly lose their job. Their income drops, like, way down. Medicaid could help them get coverage.
So it's not just for, like,
Right.
people who have never had insurance.
Exactly.
Wow, okay, so that could even cover their kids, too.
Potentially, yeah.
That's really great to know. Okay, so we've got Medicaid. I've also heard about these Medicare Savings Programs.
Oh, yeah, those are good.
What are those all about?
They're kind of like hidden gems, for people on Medicare.
Okay.
Think of them as your secret weapon against high premiums, deductibles, all that.
And copays.
Copays, yep. They can even help cover prescription drug costs,
Oh, wow.
which is huge, especially if you're on a fixed income.
I can imagine.
Right.
Okay, so we've covered a lot about original Medicare. What about people who have Medicare Advantage? If they lose their coverage, say, like, they move or their plan shuts down, what can they do?
They've got an SC2. It's a little different, though. They can switch to a new Medicare Advantage plan, or they can go back to original Medicare.
Okay.
And if they go back to original Medicare, they might be able to get a Medigap policy.
Wait, hold on. You just threw out another term. Medigap, what is that?
So Medigap, it's also called Medicare Supplement. It's like an extra layer of protection, for your finances. Like, let's say you have some health issue come up out of nowhere and you need surgery. Original Medicare will cover a lot of it, but you could still end up having to pay a ton in copays and deductibles.
Yeah.
Medigap can help cover those gaps. So you have less to worry about financially when these unexpected healthcare costs pop up.
It's kind of like a just in case.
Yeah, like a safety net.
Okay. So really, you're talking about peace of mind.
Exactly. Especially since health issues, they can be so unpredictable.
You just never know.
Huh.
It's interesting to me that we're not just talking about insurance policies here, right? We're talking about real people dealing with some tough stuff.
Yeah, I mean, these are real life situations, and people need help making these choices.
For sure.
And that's why it's super important to get advice that's tailored to you. Don't try to figure it out all on your own. In the stuff you sent me, you mentioned Diversified Insurance Brokers. They're a good example of a place that can help you figure out what all your options are.
So like having someone to hold your hand through the whole thing.
Oh, exactly, yeah.
Yeah.
Someone who knows what they're doing.
Okay, that makes sense. So for our listener out there who's maybe dealing with these choices right now or just wants to be prepared, what's like the most important thing you want them to remember?
Don't wait till something bad happens to learn about your options.
Yeah.
Take some time now to figure out how Medicare works, what you can do if you lose coverage, and where to get help. Honestly, you'll be so glad you did.
So true. Knowledge is power.
Right.
Especially with healthcare.
Absolutely.
Well, thank you so much for taking the time to break all of this down for us. I really appreciate it.
You're welcome.
And for everyone listening, here's something to think about. How can you use what you learned today to not only help yourself, but maybe help a friend or family member? Because sharing knowledge is caring, right?
Right.
Okay, well, thanks again. Until next time.
Sounds good. See ya.